Good afternoon, everyone. Thank you for joining me as a report on the COVID-19 pandemic here in Erie County. Unfortunately, today, I do not have good news. We now have 7 new confirmed positive cases in Erie County, making a total of 27 positives with 646 total negatives. The first 3 cases, we have 1 person in their 20s, 1 in their 30s, and 1 in their 70s. The other 4 positive cases came in today, and those investigations are newly underway by the Erie County Department of Health, so I have no further information on those 4 cases. The state numbers today are astounding, with 12,980 positive cases across the Commonwealth and 162 deaths. This is almost 3,000 more cases across the Commonwealth and 26 additional deaths within the last 24 hours. Included in those statewide numbers is 1 case in Warren County and 9 in Crawford County. In Allegheny County, just to the south of us, our neighbors in Pittsburgh and that surrounding area, there are 642 cases with 4 deaths. And I looked to the east and to the west. Erie County, New York, is now reporting over 1,000 cases, 27 total deaths. That would be the Buffalo, New York area. Cuyahoga County, the Cleveland area, is reporting 826 cases, with 218 hospitalizations and 14 deaths. And Ashtabula County has 12 cases, and Chautauqua County has 18. So, ladies and gentlemen, if you have not taken this global pandemic seriously, I can assure you that you no longer have a choice. You must take this seriously. As testing continues and as the days go by, we should all be prepared for a very rough week ahead. And as Secretary Levine stated, there is community spread throughout Pennsylvania. People who were sick last week or feeling symptomatic are now just finding out the results that they are positive for COVID-19. So as I said, we could see those numbers jump during the week. And I can officially say that here in Erie County, we are now seeing community spread. Again, according to the CDC, that means that people have been infected with the virus in an area, including some who are not sure how or why they became, or where, that they became infected. Please stay at home unless you absolutely must go out. We know that the most prevalent way that COVID-19 is passed is from individual to individual, that person-to-person contact with the virus. Continue to practice your social distancing or physical distancing to prevent the spread. And if you must go out, take every precaution and wear a mask. Your mask protects me, and my mask protects you. But this mask does not prevent me, when I wear it, from getting COVID-19. But I care enough about you that I wear my mask when I'm out with other people. And I'm asking you to care enough for others by wearing a mask too. And if you don't have a mask, tie a bandana, a scarf, pull up your turtleneck, something to cover your face, because we know that even when wearing a mask, you need to stay at least 6 feet away from people. But we know that the virus is in the droplets that come out of our mouth. And even if we don't think there's droplets coming out when we speak, there are. When we sing, those droplets even go farther. So wear a mask when you are around other people. Most of our grocery stores and our essential businesses have taped off those 6-foot marks to help you. Follow their guidelines so that they can help so that they can stay open to help all of us. Many businesses have reported that they cannot control the crowds because shoppers are not abiding by the guidelines and sometimes getting angry. When that happens, they have to close their doors. So simply put, if you want to continue purchasing your essential items, you must follow the guidelines and everyone else must also. Keep your distance. Our Unicast rating, which was an A- last Friday, has now slipped to a C-, which tells us there was a lot of activity and people gathering together over the weekend. The less people travel, the better. Please stop moving around. Our environmental task force team continues to make those field inspections and offer assistances to our businesses. If you need further information or guidance, check the resources page at eriecountypa.gov under COVID-19, and you can always call 814-451-6700 or email ecdhinfo, info, at eriecountypa.gov. To help ensure all of our residents of Erie County have access to information and resources about COVID-19, materials have also been made available in a variety of languages at eriecountypa.gov. If you would like to speak to an employee of the Erie County Health Department about COVID-19, but you do not speak English, then you can tell someone you know that may be in that situation that they can call 451-7801. They can leave a message, and an employee will return the call with a telephonic interpreter on the line. So I implore everyone, we are in a very tough time ahead. We cannot do this alone. We can only do it with the help of each one of you. Please do what we've asked you. Keep your physical distance. When out, wear a mask to protect the others that you come in contact with. Wash your hands frequently. Use hand sanitizer. And definitely keep that physical distance from anyone who does not live in your home. On a lighter note, as I mentioned, this week is Public Health Week. And thank you to Gannon University and our West Bayfront for the awesome greeting our health department received when they arrived at work this morning. They posted personalized thank you lawn signs for each employee and chalk art motivations. If any of you would still like to show your appreciation for our public health service workers, you can write an email of thanks to ecdhinfo@eriecountypa.gov or send them a note at 606 West 2nd Street, Erie, 16507. And now I would like to turn it over to the media for questions. And let's start with the Erie Times News.
Hi, Kathy. It's David. Can you give us some more information on at least the 3 cases out of the 7 that you have? Are any of them hospitalized, or did any of them reside in a nursing home, anything like that?
So any information I have is limited, but my understanding is that none of them are hospitalized at this moment.
And are any, to your knowledge, are any of the 27 cases currently hospitalized?
I'm not really sure. We had the one hospitalization.
From a while. Right?
Yes, and that's the only one I was aware of.
Okay.
Okay. How about Jet TV?
Hi, Kathy. It's Samir. So we know this week is supposed to be rough with COVID-19. They're expecting to see surges of cases. So how prepared do you think Erie is currently right now for that?
We are as prepared as we can be. One of the things we've done in the last couple of weeks was we bought some time by keeping our numbers low, not having the hospitalizations that other communities have seen. Our hospitals have been able to get themselves ready for any surge in hospitalizations that we would see. But as these numbers grow, I think the community needs to understand we won't be able to do this contact tracing eventually. We'll get to that point where we just have too many and we don't have enough personnel to do it. And that will be a different scenario, because right now we are doing that. We had people in over the weekend, and of course today, very, very busy doing the contact tracing on these 7 individuals, trying to find out who they have been near, and then contacting those people. And that's really been helpful to our community. But as we have more and more spread, this will become more and more difficult. But in terms of hospitalizations, I know that our facilities, our hospitals in the community have really had been bought some time by what everybody's done and helped us do to keep the spread from being community spread here in Erie County up to this point.
All right, and then just a really quick follow-up. So we know the Secretary of Health for the state was talking about ventilators in PA hospitals. Do you have a ballpark of how many ventilators Erie County hospitals have on standby?
I do not, and that would be information that would have to come from those hospitals.
Got it. Thanks.
Sure. Erie News Now?
Hi. As you say, to prepare for a tough week ahead, again, without asking you to have a crystal ball here or anything like that, or without trying to instill fear, what is realistic to perhaps expect in the week ahead here? Just what should people be kind of expecting here? What's reasonable to think might be coming down the pipeline?
So we had 3 cases that happened over the weekend. Of course, I did not have one of these press briefings yesterday, first time in about 16 days. So I appreciated being able to give our interpreter and our cameraman a day to stay home. But so if I look at those 3 cases, that would be sort of the trajectory that we had been seeing, maybe 1 a day, maybe occasionally 2 in one day. But then today, 4 cases. That is something we haven't seen up to this point at all. So that's the only thing I have to go by, is that we have moved into this community spread phase, a large number, I would say, for our community today, coming in with 4. And there's no way I can predict, what we'll see tomorrow or the next day or anything further going forward. But we are seeing a change now. And so I cannot emphasize enough how important it is that every person listening and every person not listening takes this very, very seriously and does their part for us.
Can I follow up on that community spread phase there that you mentioned that we're now in? How did you decide that we got to that point? Have you seen now definite cases where you're absolutely certain you can't backtrack on them, and there's more than one of those?
Yeah. So those of those 3 cases that came in this weekend, at least 1. And maybe some more from these 4 cases coming forward. I don't really have any detail on them yet. We can't find what the direct connection was, whether it be travel or direct contact with a COVID-positive person. And so that would now be then the second case, because we had 1 previously. So now when you start to see this happening, this is where you really do move into that community spread situation. But it's important for people to remember, keep your surfaces clean, obviously. Try to minimize your contact with surfaces and wash your hands very closely. But the easiest way to spread COVID-19 is person to person. So if you are even coming upon your neighbor outside, and many of us out taking a walk, and you're not wearing a mask, and you are within 6 feet, maybe even a little farther than that apart, and you're not wearing a mask, and you're speaking, you could have water droplets from your mouth and hit them, and they could do vice versa. So that's why I say the mask protects the people that you come in contact with. And so, but it may not always protect, when you're wearing a mask, that doesn't mean somebody else wouldn't actually be able to transfer the virus to you. So it's really important that we get people wearing masks. I think that's going to really help us in this community spread phase and help us to reduce the numbers in Erie County. It doesn't have to be anything fancy, but we all need to think about how we can protect our neighbor, how we can protect the person we might come in contact with at the store. How about Talk Erie? Are you with us today?
Yes, ma'am. Thanks for calling on me. I just had a question about what other elements are you thinking that Erie County residents are not doing? Where are the holes here? Because again,
Joel, I lost you, but I will answer your question. I think your question was, what are we not doing? I think we're gathering too much in larger groups. I don't know what age group that might be. Maybe it's young people, maybe it's others. But I think okay, go. Now I have you back, Joel. Did you have anything further in that question?
Oh, I'm sorry.
Okay, I lost you for a minute.
I'm sorry. I guess just the additional things that you would like to have Erie residents do, since up until yesterday we've had the lowest level of infection for per population in the top 10 metropolitan areas in the state of Pennsylvania. What more are you seeing that people could do?
People can start wearing masks, any kind of face covering when they are out amongst other people. And I know it's odd and it feels a little weird, and maybe even for some may feel that they look weird, but you are doing the right thing. So that mask, again, could be a bandana tied around your face, a scarf. It doesn't have to be anything fancy. We ask you not to use the N95s and the surgical masks, which should be really saved for those people who most need it. Those are our healthcare workers, people on the front lines, people who are immunocompromised. So that would be the only exception for the average citizen if you already are maybe undergoing cancer treatment or have some kind of underlying disease process. So minimize your time going into any other place. You know, I have driven by some of the bigger box stores up on Upper Peach, for example, and I am shocked by how many cars I see in the parking lot. I'm not sure how these stores can control that many people in their store. So when you are out there, try to shop later or earlier. I went to the grocery store very early on Sunday, trying to get in and out before many people were in the store. So I think we all need to think about our behavior. If I pulled up to a store and I saw a large number of cars there, I would actually turn around and go home and find another time to come. So the most you could, whatever you can do to minimize your time being around other people and staying close to home and wearing a mask when you can, and not getting together with groups of friends, whether that's a young person or an older person or anybody in between, not getting together with groups of friends. This is a very difficult thing to ask of people, but it's a very, very important and necessary thing that we ask people to do, and we need everybody to join us.
Quick follow-up. Are you ready to make an order of those that are in life-sustaining businesses to wear a mask?
In my opinion, if you're in a life-sustaining business, everyone who's coming in contact with anyone should be wearing one, because we don't know who has COVID-19. And it seems like about 25% of the people could be asymptomatic across the country and across the globe. They're seeing that. So one of your employees could actually have COVID-19 and not even know it. And we know people who are getting tested and they're negative, and then they get tested later and they're positive. So wear a mask. It's the best thing you can do when you're around other people. And that's whether you are a shopper going into the store or whether you're the person working the checkout counter, for example. I would suggest that everybody wear a mask who's going to have encounters with other people. Erie Times News?
Kathy, we hear a lot that New York City is expecting to see its apex this week. They've had a bit of a flattening of the curve. Do you expect that this is going to be the make or break week right now for Erie County, especially with the 7 cases in the last 2 days?
I think that this could be the beginning of us moving up that curve, but I'm not an expert when it comes to when that curve would happen in terms of the apex, but we're nowhere near where New York is now, or where they even were a week or 2 ago. So I guess just from looking at other models, I would say we're nowhere near an apex when it comes to Erie County at this point. So we have a ways to go.
And then a quick follow-up. Do you have a breakdown of the 27 cases, males and females, just because we're tending to see nationwide, worldwide, more men getting this than women?
I don't have that, and I haven't really seen that number laid out there, but you know, I will see if there's any correlation. Maybe if in the Commonwealth would be interesting to see, you know, in a larger setting. I mean, 27 doesn't really give us a good sample site to look at that. You really need a much larger number than that to determine if that was the case. And this is just anecdotal, but I had heard something out of China a while ago about like 90% of the men in China smoke, and I don't know if these numbers are true, but anyway, a large number of men smoke and very few women smoke. So there was some question, did that have something to do with it? But I think anytime somebody has compromised lungs, whether that be from smoking or vaping, or maybe they've had some other health issues, lots of pneumonias and things like that have compromised their lungs. I think anytime that would happen, it would make you more vulnerable to something that attacks your lungs, like COVID-19 does. So again, I don't know that there's any scientific evidence behind that, but it just sort of made some sense to me. But I'm going to check and see if we can find some numbers on the Commonwealth side, if there is that ability to do that, because I think that would give us a much better understanding whether males or females are more affected in our community. How about Jet TV?
Yep. Hi, Kathy. I believe last week the Secretary of Health released some information saying that there were some healthcare workers that did contract COVID-19. So I was wondering if any of these 27 cases that was true here.
I don't have any specifics on these 27 individuals in Erie County, sorry.
All right, and then what about presumed positive cases? Are we keeping track of that as well?
I'm sorry, what cases?
Presumed positive.
So presumed positive, meaning they haven't been tested?
Yeah, so the presumed positive, so they haven't specifically been tested, but they've come into contact with someone, so there's just self-quarantining. So I guess, do we have a number on that?
I do not have a number on that. So when you say presumed positive, I'm assuming you must mean maybe if someone in the house is positive, and then there's other people living in the house, we just presume they're positive because they live in the same home, but because we don't have enough tests, that person doesn't go get testing. I'm assuming that may be what you're talking about, but I don't have any figures on that.
Got it.
Erie News Now?
Hi, a question for you about first responders. As they head to a call, how much information are they given, even if it's not, let's say, a medical call, let's say it's a fire or something like that, how much information do they have beforehand about whether or not someone in that place may or may not have coronavirus, COVID-19?
So we have all of the positive cases in our database at the 911 center, and so those 27 cases would be in there. And if there was a fire call or an ambulance or a police call, there would be an alert that the call taker would see. They would notify the first responder to call back to the comm center, and they would be then told that there's a positive COVID-19 individual in that at that residence. If they are a law enforcement, they actually have the ability on a computer that's in their vehicle that they wouldn't have to call back. It would actually show up on their computer that there is a positive COVID-19 individual in that dwelling.
Okay, and if I may follow up on that, let's say with a police officer, say I'm arresting somebody on a domestic call or something where I'm not at their residence, would I then have a way of knowing whether or not he or she were COVID positive? Maybe they're at somebody else's house and something is going on.
We only have their addresses because that's where they are. Everyone who's COVID positive has signed a very serious letter that we have given them, stating that they must agree to be isolated in their home and to not leave. And in fact, they need to be isolated away from other people in their home. They sign that. There's some very, very serious consequences if they violate that. You have to also remember that these people are usually very sick. And when I'm sick, the last thing I want to do is go out and cause any disturbance. So these people, as we've been tracking them, we are in contact with all of our positive cases on a very regular basis, and they are all staying home where they belong and doing their best to get better, to get well, and not to infect anyone else in our community.
Gotcha. So if I'm any sort of first responder, even a fireman, EMT, anything, if I'm going to a call, I then should be aware, I would be aware that somebody there does have coronavirus.
Yes, we would start off by saying you need respiratory protection. So they would know that, and then we would ask them to call back to the communications center, and then they would be told that that residence has a definite COVID positive person in there. But we might tell them respiratory precautions if someone calls and and they don't know they're COVID positive, but they're having symptoms that could be, and they told the call taker that information, then we would advise them to use respiratory precautions. So we're trying to make everyone aware of what the best protocol is going forward. I think we're doing a pretty good job of that. So there's always, people have to tell us some things too. But if they are definitely positive, we definitely know that it's in our system, and the first responder will know that. Talk Erie?
Yes, Kathy, several calls in the station today about the case downstate where a police officer was pulling over a driver for some kind of vehicle violation and then added on a violation for, quote, taking a drive under a stay-at-home order. What is your knowledge about enforcement of the stay-at-home order? Are Erie County residents subject to getting a summary offense if they take a drive?
If they have signed our letter and we know about them and they are under isolation, yes, they are. One of the great advantages of having a health department, and I've told you many, many times, that 57 counties don't have a health department. And in fact, only 6 counties have a health department, and there are 4 others that are just for the municipality within a certain county. For example, Bethlehem has a health department, but the 2 counties that Bethlehem sits in, Lehigh and Northampton, do not have one. So we have a health department that is staffed with great people who are constantly in contact with our positive cases, and so we have a lot more probably knowledge about our positive cases than many other places in the Commonwealth do. But I really don't know anything about the case you're talking about, so I really can't comment on that specific one.
I don't think it was a positive case. I think it was just someone who was driving. They violated their vehicle deal, and almost like one of those secondary offenses, like if you're on the phone, they'll ding you for using your phone while driving. They were dinging this woman for driving under a stay-at-home order.
Oh, driving under a stay-at-home order, not somebody who is COVID positive? I don't really know. I couldn't really speak to that. Sorry.
Okay.
Okay. Erie Times News?
Yes, with planting season coming up, has there been much pressure to have more of the feed stores, the garden stores, become more on the essential list? And has there been any thought of changing that?
So, of course, this is all done under the state. The county doesn't determine, which businesses get to stay open and which ones don't, and how they can continue to run their operations. In terms of the restaurants, for example, only having takeout, that was all decided by the state. And the same is true with garden centers and other places that have landscape and edible and other types of plants. What we are doing, though, within my enforcement division, and again, another great reason why I'm glad we have a health department, because we have an enforcement team. We have people that are very talented, and they're putting together guidance for every one of our garden centers who are allowed to have pickup delivery. So what we're going to be asking is that people call ahead, have an order already paid for, that the garden centers have their people wearing masks, and that no one gets out of their car. They would drive up. The order then would just be placed in the car. There would be no exchange of money. There would be no contact physically with the people picking up their delivery. So it'd be very similar to when you go to maybe pick up groceries at some of our grocery stores that are doing that now. There's some people questioning whether this should be done at all. I see a couple things here. One, a lot of people plant fruits and vegetables and things that are going to be life-sustaining, and I also think for our own mental health, we're staying at home, we have our yard, or we have our porch or patio and want to put a few things on there. I think it's a therapeutic mentally for us to be able to maybe work in the ground a little bit and do something mentally healthy for ourselves. So I think there is a benefit to being able to do it, but to do it in a safe way. So those recommendations are being put together today, and they will be sent out to all of those businesses that this would pertain to. Jet TV?
Yep. So speaking of life-sustaining or essential businesses that are open, do you think for the companies that are open, let's say like WabTech or a chocolate factory, that they should start to minimize their staff to the best of their abilities as we are entering what's supposed to be the worst week for COVID-19?
Well, I can tell you in county government, we have already have a lot of people working from home and have had to try to really cut down on the number of people in our buildings, and we are doubling down on that this week, finding more ways for people to stay at home and do the work, or rotating more people in and out so we don't have as many people in our buildings. It's difficult to do in some situations because of the nature of the business, but we are working very diligently to do that, getting masks into the hands of all of our employees who are there, so they are wearing a mask when they are at work, unless they're in an office completely by themselves, but when they come out to speak to anyone else, they would put that mask on. So that is what we are saying we're going to do, and we are working towards that, and today is sort of the day that we're transitioning into that in county government, and I certainly would ask any business to try to follow our example and the example of other businesses. A big one is Erie Insurance. They have almost everyone, except for a very small crew of people, working from home. And my understanding is they've now told everyone they will work from home until the 1st of June. So there's our largest employer really working to help all of us stay at home and do the right thing.
And then just to follow up, do you have an update on any quote-unquote recovered cases?
I do not have an update on any of those.
Got it.
Erie News Now, do you have any final questions here?
One last one for you. How concerning is this now definite phase of community spread? I know for weeks the health department and county in general had been doing everything it possibly could, really trying to prevent this. And now that's definitely here. How concerning is that?
Well, we never really thought we were going to be able to prevent it, but we were trying to extend the time until it became a reality here. And, we hope that we got enough of ahead of the curve that our health care facilities will be able to handle any influx they may see into their facilities. Because that's really what this is all about. How do we save lives of the people of Erie County? How do we reduce the death? We haven't had no deaths, thank God for that, and we hope that we don't. But we're certainly trying to reduce the probability of that. And so the more we can stop the spread, and that only comes from people working with us, the more we'll hopefully do that. But I am very concerned. I think all of us are very concerned. I've been very concerned for weeks. I never try to give false hope, but I try to give encouragement to people to continue to do the right thing for our community, and many people have, and I thank them for that. You really have bought us time, and what people have done when they've done the right thing is saving lives. People not traveling, people canceling those travel plans that they had, staying home, deciding they will vacation another time. People who come back to our community and quarantine themselves for 14 days, maybe coming back from Florida or from some other place that they've gone to for work. All of those kind of things have helped. They will continue to help as long as people continue to do them. And on that note, I want to mention one other thing that I've heard a little bit about, and that there's maybe some contractors coming in to work on different things in our community that are coming from other communities, and I'm talking not just maybe somebody coming a little bit across the border, like from Crawford County or even Chautauqua or Ashtabula, but I'm talking people coming from much larger communities farther away who have much larger incidents of COVID-19. And I ask any business listening to please, if you are doing that, is it absolutely necessary? Is it an emergency? Because if it's not an emergency, please do not bring anyone into our community that doesn't already live here. Talk Erie, do you have any final notes? Questions?
Just one last one. Thank you. I just got off a conference call with the unemployment folks at the state level. Beyond all records of unemployment, new filings in the last 3 weeks. What is your sense of the bounce back? Erie's renewal is one of those super fragile things. There's been national reports on how everything that we've been working toward in the last several years could be vanished. with this pandemic. What's your take on all of that? Do you really think that many of the businesses will be able to come back as strong as they were just 8 weeks ago?
So all I know is that the federal and the state government and even our local government and our local foundations are doing everything possible. Well, maybe not everything possible, but they're doing a lot to try to shore up our businesses while they are going through this very, very difficult time. You know, we've had no interest loans out there, very low interest loans out there for operating budgets. That's been local. Of course, there's the federal stimulus package that was passed recently. That's the third one done by the feds. The state has funds through the DCED, what they call PETA. But unfortunately, a lot of that money has already been spoken for. But the best place for a business to go is going to be the Chamber's website, the Erie Regional Chamber and Growth Partnership. You don't have to be a member to call them, to tell them what your needs are, to see if there's some way that they can help or some other entity that they're partnering with can help. We will get through this. I truly believe that our community is strong enough and resilient enough. We've come through many, many challenges over decades in Erie County. And I think if we're going to come back and come back well, it's going to be because of the work that has been done in the last few years and the changes we have made in our community over the last few years, both from our private business side, our philanthropic side, and our government side. We have tried to set up our community for success, and none of us ever dreamt that we'd have to deal with an issue like this. But if we were ever going to come back strong after something like this, I think now is the time, because we've all come together as a community, collaborated, found ways to assist each other, broken down the silos, and said we're going to make our community better because we're going to, by doing it together, by doing it collaboratively. And that's why I have great faith in this community, great faith that we can get by in this terrible time, and that we will help our neighbors and help each other, and we will keep the kind of attitude that we always have, and it's a very strong, gritty attitude in this community that we will pull together and do it together. So with that said, I thank you for that question, because I think it's a really important question, and none of us have the crystal ball to determine what that answer is. But I know this community is up for the challenge, so I thank everyone who's helping to get there. First of all, by helping to save lives and by staying home. So with that, please stay home, please stay safe, and please stay calm.